Hello, everybody. Welcome to our all-member call today. Wow, looks great. Thank you all for visiting with us today. We'll give everybody a few more minutes to get here. We have a couple presentations today, one in pharmacy and the both actually from pharmacy. One from our pharmacist, Kyla, and then the other one from one of our community partners here in Hawaii, talking about diabetes prevention programs and self-management education. All righty. Everybody see my screen?
Yes.
Great. All right. Well, let's get started. Thank you all for attending today, our Regional Community Coalition call. A few housekeeping items to get us started. Please do mute your microphones during the presentation. Enter any of your questions into the chat box and share your experiences with the group as we go into our presentations today. What we'd like to get started with is please put your name, organization, coalition name, and location, and any activities and or updates that you might have. We'll be asking a couple of times during our presentation today in our meeting to talk to you about what's going on with you folks. So we're going to take a pulse check here as we start. How can Mountain Pacific Quality Health support you? For the coalitions that you have, we want to make sure we have updated member names and contact information. Are there additional or potential partners for recruitment that we're going to be reporting out on? We are in a contract modification has dropped, so we'll talk a little bit about that today. We do believe that more recruitment will be necessary, more aligned with the work that we're doing. We're also interested in knowing about the three most important areas of focus in your community. And then we want to make sure that we have coalition participation agreements. If you're using a charter for 2022, make sure it's updated. We'll be rolling into 2023 before we know it. And our next all-member meeting will be on October 25th, this year, 2022. We're looking at categories of care going forward, and we will be polling during our time together today to try to get a better idea about where we're at on these different goals or categories that we're looking at for community health. One is opioid adverse drug events, ADEs, and reducing deaths. We're going to be working on chronic disease management. And so the goals for 1 and 2, we've got presentations that will be given today to talk a little bit more about that. Care coordination. It's a yes or no answer pretty much across the country now. All of our partners and all of our facilities, all the people we work with have to have emergency preparation plans and need to be prepared for what comes next. That's one of our identified measures. We have a couple of developmental measures under care coordination that we're looking at that deal with the appropriate use of both the emergency room as well as the hospital and with multi-visit people who spend more time at those places for other areas other than just healthcare. We'll be looking at that more into our future. It's a developmental, those two are developmental measures, and talk a little bit more about them later. And then we're looking at immunizations, both flu, pneumo, and then obviously COVID as we go forward too. So these are some of the different areas that we'll be looking at as we go forward. And these are things that we'll be working on as a team. So do we have any, I think we've been hiring some folks, but I don't think we have any new people who are going to be here today. I think they'll be starting next month with us. So we will be having in Wyoming and hopefully one in Montana and hopefully one in Hawaii. We will be bringing in some new account managers to be working on both nursing home and coalition work. We are also looking at our metrics across the region. Our region is Montana, Wyoming, Alaska, Hawaii, Guam, Saipan, American Samoa. These are all the areas that we work. Obviously, a great range in terms of time and space, as well as geographic location. Our area is huge, but at the same time, some of these measures that we're looking at, we're going to be trying to wrap around the measures that we have in nursing home, as well as the measures that we have in coalition work, and work through them together. We'll be talking a little bit more about vaccinations. We are working on creating data by coalition so that we'll be able to create baselines and see where we are and where we're going moving forward. And the work that we'll be doing, as I said, in the similar categories within the nursing home task order that we're working on both. So both of those are fairly significant now as we're going to be working together across all of our region on them. So we're going to start with our first presentation. And so I'm going to let Kyla, Emily take over from here. Go ahead, Kyla. Let me know when you need me to advance the slide.
Perfect. Thank you, Mark. Thank you, everybody, for attending today. So I just wanted to go over a few of the resources that are out there related to vaccination, since that's one of our areas of focus, and I know it is in your communities as well. Being able to provide all the resources that are out there so that you can distribute those to your patients and providers in your area. So this is the first one. This originally was a field guide that was put out to address vaccine confidence and increase vaccine confidence, reduce hesitancy, however you want to put it. But they did make an addendum where they put in 12 strategies for rural areas, which I thought was really nice. So looking kind of more at a lot of the areas that I know the folks on this call work in. So I have the link there. These slides will be sent out after, and I would encourage you to take a look at that guide. Next slide, please. This is another campaign that was put out by the Ad Council. If you're looking for ways to distribute information in your communities via like social media, or they have videos, a lot of different flyers, just a whole bunch of different really good resources. And I really like their slogan, "It's up to you," that really kind of puts that choice on the patient and makes them feel empowered about getting vaccines. Next slide, please. These are two training modules that are available. One of them is from the ISU UAA Alaska Pharmacy program. It is on their website, and it is open to everyone. You can only get CE for pharmacy, however, but it's really a good resource if you want to do a training on how you address vaccine hesitancy. And then one other one I included here from Stanford Medicine that I thought looked pretty good. And I believe that was accredited for CE in a variety of areas. Next slide, please. This is something that was shared with me from our School of Pharmacy up here in Alaska. Thank you, Renee Robinson, who was one of the main producers of this. It's a talking points and specific questions and how to address these with patients. It is not listed online yet, but we will attach it to our, when we send out the slides, we'll attach a PDF of this if you want to take a look at it. And I think Renee might be on the call if she wants to say anything additional about it.
Hi. So just thank you so much, Kyla. I appreciate you sharing this. So we actually developed this through an educational grant in which we did some qualitative work working with a number of different pharmacists as well as patients, doing some qualitative and quantitative work to figure out what were some of the questions that people had who were hesitant and who had not yet necessarily gotten vaccinated. And so then we married that with other additional resources that were available by the CDC, et cetera, to identify how can we maybe share a little bit more information with people so they might be a little more open to hearing about it. And so this is a culmination of a year and a half of work, really trying to get to that point. And so we'd love for you guys to use this. And sometimes it's just helpful to have different words to potentially share and things that other individuals have utilized in the past or recommended, to us, either patients or providers. And then just a shameless plug, we're also looking at ways to address empathy coming across. So not only what you say, but how you say it. And so we're doing a few other kind of next step strategies to help to kind of provide some supports for individuals who might be struggling with that as we're all, overextended on a day-to-day basis.
Well, thank you. Thank you, Renee, for all your work and for being such a great partner to support the work that's going on in Alaska. So switching gears a little bit, next slide, please. Another thing that I wanted to just bring folks' attention to, if they weren't aware or hadn't heard about this, is a big opioid settlement that was finalized in February of 2022. And basically, money was given to each state to combat the opioid epidemic. And each state has kind of a different plan on how they're going to approach this in their state, where they're going to use the money, how they're going to engage their communities. And this is just kind of an overview. There's a separate tribal agreement as well that's specific to some of the tribal areas in our states. And I know Alaska right now is really kind of trying to figure out how communities are going to use this money. And so I'm thinking that's happening probably in your states as well. On the next slide, I actually provided some resources. There's one, Mark, we're seeing your desktop.
Oh, now we have a little bit of an issue here. I'm sorry.
So I can keep talking. Basically, oh, there we go. Yep.
We're in the right place. Okay.
If you would go one forward. This just
Okay.
talks about, yeah, these are all the resources I found that kind of give an explanation of what it looks like. There's the last one has the state's opioid settlement status. I thought that site was really good because it shows each state and how they're handling it, what they're doing in their communities. So take a look at that. And I know in Alaska also, I was going to share that they're doing these community cafes in the communities that have where they have dispersed or designated a portion of the funds to really find out what's going on in each individual community and get input from the public, basically. So that's one way that they're approaching it here in Alaska. And then one last thing I wanted to mention about the immunizations that I forgot to mention is that next month is National Immunization Month. So I'll put in the chat the website for that, and there's a lot of good resources on there that you can use to promote vaccines in your communities. So I think that's all I have, unless anybody has any questions, and thank you for letting me speak today.
Thank you, Kyla. I'm going to stop sharing for a minute. Mary, can you share your screen, please?
Sure, hold on. So I have the
Okay.
question one. Is that what you see?
Yeah, that's what we're seeing.
Thank you.
Okay. So we'd like to ask some questions here. So care transitions are important in preventing readmissions. Overutilization of the hospital emergency departments and observation admissions and reducing overall harm. In what ways do you feel your community can impact this work? So his polling question is up. A, provide education at the community level. B, through presentations to community groups. C, through a virtual web presence. D, through marketing materials. And E, other. Please, any other that you have, please enter in chat. Okay. "74% provide education at the community level and 45% through presentations to community groups. Next, through marketing materials. And then virtual web presence and others. I think Danielle just added something in there, support with quality improvement projects. Addressing this issue for older adults and ADRD. Okay, terrific. Okay. Good. Mary, can you go on to the next slide, please? All right, another polling question for us. What actions are you ready to engage in to support overdose prevention improvements in your community? A is expanding naloxone and education outreach. B is education and prescription monitoring. C is initiating medication-assisted treatments in the emergency department. And D, participation in a work group discussing non-pharmacologic pain approaches. Okay, 55, 52%, 48%. We're still getting some more in. 44%. Talking about expanding naloxone distribution and education. 41% for both B and D, education and prescription monitoring, and participation in a work group discussing non-pharmacologic. And C, initiating medication-assisted treatments, referrals. Looks like 52 have participated. Anybody else? All right, thank you. All right. So we're happy to have with us today the diabetes education team from one of our partners here in Hawaii, the Times Pharmacy Diabetes Education Services. And we'll stop sharing our screen and move on. So Cleanne Toner and Shelby Metter will be taking us through their DPP and DSME programs. Hi, Shelby, are you able to connect here?
Oh, Shelby, we still can't hear you. I can go ahead and for her.
Okay,
Yeah, and Shelby, I'll just ask you for next slide. No, no worries, Shelby, no worries.
yeah, we're good.
So aloha and nice to see everybody on board today. My name's Cleanne Toner. I'm the clinical pharmacy manager here at Times Pharmacy. I have Shelby Meter. She's our diabetes education coordinator. We're both excited to share our services we're able to provide for patients out in our local community. Let's go ahead and get started. Next slide, Shelby. So I'm going to first start off with the services we have for our patients diagnosed with diabetes. And these are our guys that are 18 years of age or older. We don't currently have a program for children at this time. But for 18 years of age or older, we offer a couple of options for these patients. The first being our Teach Me Diabetes program. We're able to provide this class in person or online. And we started off with a one-on-one appointment with each patient. This initial interaction involves us getting to know the patient, assessing their health status, medications, diabetes knowledge, and lifestyle practices. We do go through the ADCES, or the Association of Diabetes Care and Education Specialists, seven self-care behaviors. And we make a plan with the patient in regards to starting classes and just really focus on what their goals are and what they would like to work on moving forward. Because again, this really puts it back into the patient's hands and what they want to do with their diabetes care. But once we have at least 5 patients, we are able to set a date and time for the group classes. The patients will attend a series of 1 to 2 hour classes. And we focus on those 7 self-care behaviors again: the healthy eating, being active, monitoring, taking medications, problem solving, reducing risks, and healthy coping. These classes are interactive, and we really try to bring different ideas and teaching methods to classes to keep our patients interested in coming back. Our goals with these classes are for the patients to really walk away feeling more confident with the knowledge and skills necessary to make the best possible decisions in regards to their own care. So once a patient completes our program, their post-assessment education plan, interventions, and outcomes documentation will be forwarded to the referring provider, along with any recommendations for further follow-up. Next slide, Shelby. So as far as our class locations go here in Hawaii or on Oahu, we do have a partnership with the Mari Sabio Medical Complex. And we did start a Saturday DSMES group class this month. We're also able to hold classes at the HMSA Center in Pearl City, and we hope to have a Wednesday weekday group starting there soon as well. For those patients closer to our main pharmacy office, we're able to use our conference room at the Times Pharmacy Kamehameha location. And as our services expand, we're always looking to find more convenient locations out in the community for our patients. Now, if there are, let's see, in the chat, are the diabetes self-management small group classes live or virtual? We can do both. We can do both. We do actually have a patient in our class right now that prefers to log on from home. So we have that capability as well.
Hey, can I ask you a question?
Sure.
I didn't know if I had to chat it in, but I'd be very interested. First of all, thank you for sharing this information, but I'd also be very interested in what your, how many people actually finish all, I think it said 5 classes. We have some trouble getting people to stick with classes that are kind of even just up to 8 weeks long. And I'm wondering what your performance is on that.
So we actually have just restarted our classes up. We really have been focusing on COVID vaccinations in the past year. It is difficult to keep patients coming back, you know, especially when we were on the virtual platform during COVID. I don't know, I think, you know, at this point we do have 10 patients in our July class, and we have a solid 5 or 6 coming for every class at this point in time. So, you know, the focus is to really get, you know, have those interactive class meetings and just keep the patient wanting to come back. But let me go ahead and get through all the slides first, and then we'll take questions at the very end. That way we can get through it. No worries.
Done.
Yeah, no. All right, let's see. So as far as referrals, if we have any providers here on the call too, if you would like to refer to any of our patients or your patients to our diabetes self-management education services, we have you fill out our Times Pharmacy DSME consent and intake form, which we can email out through Mark and Kyla with the slides after we're done. It would be extremely helpful to also have a copy of the patient's last doctor's visit, medication list, most recent labs to include A1C and a lipid profile. And then following the completion of our program, we'll also send out a request for current labs to incorporate into any follow-up sessions with the patient, as well as for data collection in regards to quality improvement and measuring the success of our patients. Next slide, Shelby. Now, if your patients don't feel comfortable meeting in a group setting, we are able to provide continued one-on-one sessions. We're able to cover the same information as our group classes and can meet with the patient in a convenient public location, a virtual setting online, or over the phone. We offer convenient scheduling to try and find the best time available for the patient. As with our group classes, we work with the patient to develop achievable goals that will really help them feel more confident in their self-diabetes care. Next slide, Shelby. We also have our diabetes prevention program with CDC recognition for both in-person and online programs. Currently, we have about 37.1% of Hawaii's adult population living with prediabetes. And we're really hoping, through our programs, we can help reduce the number of patients that progress to diabetes. Both programs are lifestyle change programs and a 1-year commitment, which, as we all know, can be really hard, really tough for our patients to, continue out through that whole year process. So the first half of the year, our classes focus on making changes, those lifestyle changes that'll stick with the patient, while the second half focuses on maintaining. But patients to think about for this program are at higher risk for that are at higher risk for prediabetes are those who are 45 years and older, those who are overweight, have a parent, brother, or sister with type 2 diabetes, are physically active fewer than 3 times a week, or ever had diabetes while pregnant, or gave birth to a baby who weighed more than 9 pounds. Slide. To be eligible for our DPP program, patients must be 18 years of age or older, BMI, we've got those listed there, not previously diagnosed with diabetes or pregnant, plus one of those following lab values listed. If the patient has Medicare, the high risk score, though, does not count towards eligibility. We do also have a DPP intake and referral form for our program that we can send out as well after our webinar. Next slide. So our in-person DPP program follows the Prevent T2 curriculum led by the CDC and was recently updated this past year. The program's been shown to cut the risk of developing type 2 diabetes in high-risk patients by 58%. So much like our DSMES classes, participants will meet in groups to learn about healthy eating, physical activity, problem solving, stress, coping skills. We'll meet for an hour once weekly for 16 weeks, and then we move to meeting once or twice a month for the second part of the year. Our minimum to start a class is also 5 patients, and we can coordinate with one of our community partners for a convenient location as well. Next slide. Our online DPP program is through the HALT, our health and lifestyle training platform on the Hawaii DPP website. So each participant in our online program will be assigned a personal health coach, as well as given online peer support. The patient will be able to access the online program through their smartphone, tablet, computer, completely on their own time. But the platform offers the participants interactive and engaging online video lessons. The app is really easy for tracking their exercise and nutrition. And then, of course, they're going to get unlimited feedback and consultation with us, their personal health coach, throughout the 12 months. The time requirement follows the in-person program with committing 60 minutes every week for those first 16 weeks, and then once or twice a month for the remainder of the year. So this is a little bit more flexible. And at the patient's own pace. However, they are not able to skip ahead and finish early because we really want to get those lifestyle changes, committed for the patients. Next slide. So in regards to health insurance coverage, we have listed here who we are contracted with to provide these programs to. With DPP, we are working with HMAA and HMSA to get that approved as well. That's in progress. But if a patient's insurance isn't listed and you feel like they would benefit from one of our programs, please reach out to us. We can most likely provide the services to those individuals outside of insurance coverage. Next slide. These are just a few additional pharmacy services we're able to provide here in Hawaii. We have 12 locations on Oahu, 1 in Maui. So we have our prescription and diabetes services, and we also offer on-site business vaccination clinics. So right there. Okay, and that brings us down to our contact information. But let me take a look through the chat. I know there were quite a few questions.
Yeah, I know Dave and Agnes had a few questions.
So how do we get our referrals? So we do get referrals through our community partner, Mario Savio, the medical complex, with their physicians in the complex. We do also reach out to our patients and just ask them, at our local pharmacies and ask them if they're interested. And if they are, then we can get a referral from their provider. And as far as cost, I know with Medicare, there is usually like a small copay, but we know it's hard to get our patients here in Hawaii, first to come to the classes, and then second to want to pay for the classes. So we usually waive any copay for our patients. You do any follow-up with those who do not attend? We do follow up. with those that are not attending. And we try to accommodate, based on whatever the needs are of the patients. But sometimes we find out that, it's just not for them at this point in time. But we do ask that they, call us should they ever want to start back up with us. Must they be referred, or can they just do it on their own? For our, Shelby, if you can,
Yeah, can you hear me now?
I can hear you now, yeah. So is it the
Okay,
DPP we don't need referrals?
Yeah,
I'm gonna let you
so
take this.
DPP, oh yes, sorry about that earlier. I finally figured out how to fix my audio, but for our DPP, no physician's referrals are needed. The patient can self-refer. For DSME, we've had participants express interest to us, so we then just give the physician offices a heads up and notification, and then we just ask for the information that we stated in the slide and what we needed from the physicians. But patients can come to us as well, or if there's people that are referring, then we can just make contact directly with the patient.
So then another question came from Sabine Shank, who was asking, do you have any follow-up with those who do not attend to find out what the barriers are?
Yes, we always attempt to make contact. For example, in our current cohort that we have right now, if people haven't come and I have tried to reach out to them, once I make contact, I just ask them, what's going on, and then if a lot of the times it's their schedule or last minute things come up, or they're just not ready to take a class at this time, but we always will follow up with them in the future when we have future classes to see if they're interested.
Perfect. And Dave had another question about those who participate. How do you measure patient outcomes?
We like to look at the lab work, so like A1Cs. That's why we request from the physicians. Unfortunately, we don't have an EMR that we can share with all the doctors that we provide services for. So having that lab data when they have their follow-ups and prior to starting their class is helpful in us determining their outcomes. But also behavioral outcomes too are things that we measure just based on the SMART goals that they create and the life changes that they make as well.
Terrific. Thank you. And then Crystal had a question. Who's responsible for payment to the health coach? Insurance, she asked. Is it?
Leanne, would you have a better answer for that? Yes.
For DPP, if that's what we're talking about for the health coach, it would be the insurance provider. However, right now we are just getting our diabetes prevention program started back up. So for our first 10 patients in the online and in-person programs, we're going to be waiving any of the fees associated with it. But in the future, it will be through the insurances. And then I did see one, is our DSMES program certified by ADCS? Yes, it is.
Okay, great. Thank you guys very much. Anybody else have any other questions? Okay, you guys.
Sorry, Mark.
No, go ahead. Yeah.
I just wanted to add something for our billing. I'm not too sure if we mentioned it, but with insurance coverage for Medicare Part B patients, we're able to serve the areas of California, Nevada, American Samoa, Guam, and the Northern Mariana Islands, along with Hawaii as well. But just wanted to share that information.
Great. Thank you very much. All right.
I will.
Yeah. And Mary, if you could share your screen again. The Billings Coalition, according to Dave, is working to network those who treat and care for at-risk populations, particularly those affected with chronic disease. The initiative includes outreach to providers on the Crow, Northern Cheyenne Indian reservations in order to improve and strengthen care transitions for inpatient discharge from Billings Area Hospital. And Dr. B was talking about one of the most important areas we're looking at is actually finding out what patient and family really want from their health care. Mary Tonetti has a great site called Patient Priorities and Care. So thank you folks for sharing. All right, got another polling question for you. Question number 3. What actions are you ready to engage in to support better chronic disease management? Wow. Okay. Participation in a work group related to patient-centered or implementing care. So we're looking at self-monitoring blood pressure, number 1, diabetes programs that we just heard about, number 2, or B, participation to prevent progression of chronic kidney disease, and number 4, participate in cardiac rehab program development. So right now with 24 of the people responding, about 48% participate in work groups related to patient-centered diabetes management programs, DPP or DSME, followed pretty closely by self-monitored blood pressure programs or participation in work groups to try to prevent the progression of CKD. Thank you all very much. Okay, next slide. I'd like to be more interactive at this point, folks. I know a few of you have put some things in chat here, but we're interested in the challenges that you folks are currently seeing in the coalition work that you're doing. So please unmute yourself and let us know where you're at right now with the challenges in your coalitions.
Mark, I
This
would
is
say,
Catherine.
this is Crystal, and I would just say the changing of staff and the coming and going and, reorienting folks to the coalition work.
Thanks, Crystal. I think we're seeing that everywhere. So yes, that probably is the biggest challenge that we have.
Yeah, I think people are just burnt out. I think that getting people engaged is very difficult. And unless you have the buy-in from your local medical facility, it's really hard to move forward with things.
Yeah, we've seen quite a bit of that throughout. And in particular, like you said, Doctor, not only do we have burnout, but it's hard to find people to replace them once they do, as Crystal said. If those folks who had done the work previously have left, it's really hard to orient them towards the work that's going. We are looking at a new recruitment period for the coalition work that we're doing. Once we have it all assembled which should be sometime next week internally. We'll be sharing this with all the contractors as well as all the other leads, how we're going to move forward through this. And then as we identify what other partners need to be at the table, we'll be working on that also. And so I think we'll have a better idea going forward. It's taken quite some time for our contract modification to actually be spelled out, but now it's here. We'll work our way through it, and we'll be looking at different ways that we can all work together. We do have a bright spot that was shared with us. We wanted to congratulate the Sydney Health Center. They were granted a Quality Improvement Award for outstanding work that was done during a COVID-19 surge last winter. I know they worked somewhat with us, but we wanted to give a shout out to you folks for the great work you've done to being one of the bright spots over what has been a very, very difficult time for healthcare workers. So, yeah. One of the outcomes that we'll be looking at very shortly is we have a number of different opportunities to create data down to a coalition level. As I mentioned to you previously, we are working on identifying that information, and once we have it all together, we will be sharing it with coalitions. We're going to be working regionally, but we're also going to be looking at it locally. Any other ideas, concepts? Next slide, Mary. So one of our other polling areas that we're interested in is, would you like to participate in a discussion about using the shared decision-making approach in any of the following areas? A is chronic disease management, B is pain management, and C is information regarding advanced care planning and advanced directives.
Mark, you might want to explain what shared decision-making is. I'm not sure if everyone knows.
You know, it's come up about 5 times this past week. And I think there are a lot of people who are questioning it, but whether it be through age-friendly health systems to discuss different ways that providers and healthcare workers and people and families and caregivers get together to decide what they'd like to do with an advanced directive or an advanced care. But mostly it comes down to agreeing upon what type of care would be most appropriate based upon the current issues with the person.
Mark, can I say something here? Because, you know, I have a certain bugaboo about advanced directives, and it's really shared decision-making has to be done concurrently and not as, okay, we've got this advanced directive, what does it mean? It's really about how do you want to, you know, it's on the provider to say, how do you want to manage this? How do you want to deal with these issues? And what are the issues that really matter to you? And if you start there, then you can get some kind of shared decision-making, as opposed to a provider saying, okay, we need your hemoglobin A1C to be 5. You know, instead it's, what matters to you? What's important to you about taking care of your diabetes, and how can we help it so that we can, and what's an agreed upon goal for taking care of your diabetes? Does that make sense?
Absolutely. Thank you very much, Doctor. Yeah. So 20 of 42 people have participated. 40% say chronic disease, 20% say pain management, and 40% are looking at shared meaning. So thank you very much. Thanks, Doctor. All right. Next slide, Mary. And one more poll, folks. We're looking at our polling questions around the new measures or the way the new measures or the different types of measures are being described to us. So what other areas is your community in need of assistance or support? A is immunization, resources and tools. B is education about how to address vaccine hesitancy. C is assistance implementing public health emergency preparedness plans. D is medication reconciliation. E is toolkits for care transitions like the Project Red. Clinical pathways for specific diagnosis and expansion of community health workers.
Mark, this is Catherine again. What is Project Red?
Project Red. Amber, were you part of Project Red? For some reason, I thought maybe. No.
Mark, this is Crystal, and it's a tool that's used by AHRQ, and it's on readmissions. And I know that the hospital in Sweetwater, the director of nursing there did her doctorate degree on it. So their hospital went through this Project Red. I believe it's called Project Ready. It's re-engineered discharge something, I can't remember, but
Yeah, it said it was Project Reengineer Discharge. I know it was started at Boston University and it tries to test strategies to improve the discharge process.
Huh,
Yeah.
okay.
so something to think about. We could have our coalition from Sweetwater come and talk about their journey if you'd like.
Yeah. I'm going to put the toolkit in chat, okay? So that you'll have that.
That'd be great. I would love to have contact information for who's ever in Sweetwater.
Okay. Great. And do we have any results, Mary? There we go. Oh, pretty well spread out throughout all the different ones that we're looking at. So thank you for your participation in this. Looks right now like immunization resources and tools, toolkits for care transitions. I did add the red kit in the chat if you guys would like to pick that up. How to address vaccine hesitancy. 27% of public health emergency. We have a lot of resources. We'll be sending those out. We send them out with the OneNote that we list all of those that we're looking at. So we'll go forward from there. We're all interested in the expansion of community health workers. And we know that there have been work done here in Hawaii, but we're seeing work in Alaska, Montana, and Wyoming also. And we'd kind of like to see how we might be able to standardize that work going forward. So, terrific. Thank you all very much. Next slide, Mary. So events that are coming up every Wednesday, we have It's Worth a Shot series. The meeting registration, it's a Zoom account, it's every Wednesday. And then we're also doing 3D Echo, first and third Wednesday of July, August, and September at 1 p.m. And we have the quarterly Regional Coalition All-Member Call coming up in October. The same one we have now, we'll be doing that again in October. Now, Barbara said something out somewhat similar to the Aspire model for Project Red. It aims to reduce readmissions and provide better care for persons and education for providers and hospital teams. Oh, all right, Dr. B, we'll see you later. Next slide. So are there any other questions for us today as we're moving forward? We got about 5 minutes left. As I said, we will be checking in very quickly here with some of the changes we're going through here at Mountain Pacific as a result of the contract mod. But at the same time, we are also bringing in some new people to work with us going forward. So we have lots of new areas that we'll be working in, but at the same time, a lot of it's related to the work we've already done. So We will keep you posted. The evaluation is in chat, so if any of you would like to evaluate the meeting today, please go into constant contact pages there, that evaluation link, and fill that out for us if you would. Next regional meeting would be October 25th. And it's across the region, so all different time periods there. Anything else? All right, well, thank you guys very much. We appreciate your participation and we look forward to the coming months here as we get set up and roll forward. Thank you.
Thanks, Mark. Good job.
Thank you, Mark.
Thank you all.